I'm going to share a quick trick for how I have managed slipped ribs while waiting for surgery. This has helped me a lot on days when I've been particularly flared up or on days when I'm just normal to a little bit flared and I know I need to do more either in the house or driving or something like that. This has kind of helped give me a sense of stability without compressing or restricting my breathing at all. So what I've done is I have bought K-tape, which is you can get at any drugstore, most drugstores I should say, and it comes usually in pre-cut strips like this or in a roll. What I do then is I cut it about here, so I end up wasting that little tab at the end. I cut it about that length, and then I cut it down the middle till I end up with something like this. I guess it's a little bit longer than my finger. It's kind of like rib-sized. So then what I do is I make anchors. This is not my first take of this video, so the anchors are already torn. I'm gonna try to put it back to show you. So the paper comes like that. It's fully papered, so I tear it, pull it because it's elasticized, and then I take the tab off the end. So I've just got this little sticky tab that stops it from like folding on itself and sticking on itself. And so I make 2 tabs at the end where the sticky's off. Those are gonna be my anchors, okay? I'm having surgery tomorrow and I don't wanna put these on my ribs, so I'm gonna show you on my tank top, just because I don't want any residue of the adhesive to be left behind that I'm kind of having to scrub off. So, so what I'm going to do is I'm going to find the painful rib right there, and I'm going to put the tab just above, and I'm going to do my best to get it right on the rib, not on the intercostal space. And then I'm going to take off the rest. Okay, my anchor's down, and this is where I'm going to pull, as if I'm trying to do the thing that we all dream of doing when we have slipped ribs, is pulling them back together. And so I'm going to pull not 100% as far as this tape can go. When you use tape, you should really only pull it to about 60, maybe 70%. Try less if you're doing this the first time, because I would hate for it to make you feel more uncomfortable. So the anchor is down. Now I'm going to pull and stop, and now this anchor goes down. Now, I'm going to do another one because that one looks like it's too much up into my diaphragm, okay? The space that I want to kind of snug together a little bit and stabilize is right here. So I'm going to do another one. Here's the rib size tape. I'll tear an anchor. I'll tear the other anchor like that. And then I'm going to take the tab off. You don't necessarily have to do the other one. And I'm probably going to start on the one below. Right there. And sometimes I do several because I have several slipped ribs. And I'm going to hold it and I'm going to just give it a little tug like that. And it can overlap because if you, Hillary, take the tag off, and I'm going to pull and anchor it. Because if you imagine the costal cartilage, it does come around and join. So it's okay if they overlap here. And that looks to me like it's in a better spot. It's not gonna like give me that diaphragm spasm, can't quite take a full breath feeling, which a lot of us deal with anyway. So I've not done more than 2 at a time. So if you've got 8, 9, and 10 are slipped, just pick the most painful sore spots and do those 2. You can experiment with this, but do reduce, like really limit how much you stretch it the first few times that you use it, so that you're not pulling too tight and you find it's aggravating you. So do test it. This is just something that has worked for me and helped me get through some tough days when I have to actually function a bit more than I'm used to, or I know that I'm capable of. And I really, really hope it helps you get through those days and help you function a little bit better too.